The World Health Organization said today that the West Africa Ebola outbreak has killed more than 3,000 people and infected more than 6,500 so far. The U.S. is sending 3,000 military personnel to build 17 treatment facilities in the weeks ahead. But Dr. Jon LaPook reports there's only a handful there now.
The military eventually hopes to provide 1,700 new beds for patients and train up to 500 local healthcare workers each week. Dr. Paul Farmer co-founded Partners in Health, an organization that helps build healthcare systems in developing nations. He was recently in Liberia and met with President Ellen Johnson Sirleaf.
We're hearing about potentially hundreds of thousands of people being infected. They're maybe going to build 1,700 more treatment beds. There's a disconnect with numbers. How does it get handled?
Yeah, 1,700 treatment beds does not seem like a lot to me when you're talking about a potential need of that scale. And so I think there is a mismatch in the math.
But even if there were enough supplies, Farmer says much more needs to be done to bring the Ebola epidemic under control in a region with broken health care.
To stop it, you have to do two things at once. You have to respond to the emergency, the crisis, but also to build a really strong public health system that could go all the way from villages and communities to hospitals. That's a tall order.
New therapies and vaccines are being developed, but they won't be available for many months, says Ebola researcher Thomas Geisbert of the University of Texas Medical Branch.
The goal at this point is to contain it, to isolate and quarantine the affected people, and that's the more important thing that could be done right now, more so than the vaccines or the treatments. I'm not sure that they will be available really to manage this current outbreak.
We know how to prevent Ebola. What we need to do is apply that knowledge to building healthcare systems and to financing it. We can do that.
Farmer believes the mortality rate can be dramatically lowered with modern treatments like IV fluids. He says an improved survival rate would help convince frightened victims to seek help rather than staying at home where they often spread the virus to caregivers.
John, thank you very much.